I'm HIV negative, but I, came of age during a time where that was what was dominating the news. I grew up outside of New York City, and people were dying of AIDS left and right in the late 80s and early 90s. That was still happening. And so, I came of age with safe sex. Like, condoms were part of the deal. And then I had an education. I had a job. I had a roof over my head. Yes, I was using substances, but I had a lot of privilege within my substance use. So the choices I made and the way things went for me would look very different for someone that maybe didn't have those privileges, right? My own relationship with substances probably started at an average age around, 13 or 14, kind of classic cannabis, experimenting with pills you find in your parents' cabinet, some Vicodin, some Xanax. High school, as high school went on, more into psychedelics and, a little bit of coke, a little bit of ecstasy, and probably same for college. Lots of psychedelics, lots and lots of psychedelics. Probably right after college, there was a moment of experimenting with heroin and kind of keeping in time with very 90s what was happening in that moment, but it was very recreational. I moved to San Francisco right after college in 95, and that was the first time I'd ever used methamphetamine. Some people can manage using heroin every day in their life, and I thought myself to be that person. There might be others that thought I managed less than I did, but, I started a youth-focused needle exchange program in the Haight while I was using daily. I was able to write grants and go to community meetings and make all the things that needed to happen while on heroin. So, for a lot of people, that's a notion that they don't often, that's a little incongruous. They don't think of those two things going together. And, that was my relationship to heroin for quite a few years. And then, things got to a point where it didn't make sense for me anymore, and it wasn't as easy to manage, and I felt my health getting impacted. It hit a line for me. Like, it was just at the place where I was like, this doesn't feel so fun anymore. This isn't working. A couple of friends had overdosed and died. It started feeling very heavy and not the direction I wanted to go. There were a few different attempts of stopping, and it took quite a while. Eventually, one of those attempts stuck, with acupuncture, herbal medicine, some Suboxone, some Vicodin, kind of a mishmash of things that I made work for myself to get away from injecting. But I never stopped using drugs. That wasn't where I was at. I wasn't one of those folks that went to a treatment program and, followed a whole 12-step thing. That really didn't resonate for me at all. And so it just became more about the relationship shifting and changing. People who use substances have been integral in the fight against AIDS and the fight for their lives, trying to stay alive around opiate overdoses. In the late 90s, I was an outreach worker, a young person that also used drugs, and there was a great need for there to be syringe access for folks that were under 18. At that time in the Haight, there were so many young people living on the street. It was a few years after Jerry Garcia had died, and a whole bunch of young people had come to SF for the funeral, and lots of people never left. You had tons of young people living in Golden Gate Park, using lots of speed, lots of heroin, and, they needed clean syringes. They needed all kinds of health care. They needed all kinds of services. A friend of mine, Dan Big, who ran a huge program, needle exchange in Chicago, the Chicago Recovery Alliance, he used to come here and visit with duffel bags full of naloxone. This was all underground stuff. We were not sanctioned by the Department of Public Health. We were just doing this. We trained each other. We trained all the other young people in the Haight, and, made sure folks knew how to save each other's lives and got Narcan out there. It took, that was in 1998. I think the city didn't get on board till 2002, 2003. Over the years, it has gotten professionalized and become something that, every organization says, oh yeah, we have a harm reduction model, but what does that really mean? Like, this came from people who use drugs. This came from people seeing each other dying. If you want to save each other's lives, oftentimes you just have to do it. And that could be things that weren't necessarily legal. My own experience with substances definitely helps with working with folks who use drugs, with designing programming, with managing a team of folks who work in harm reduction, who may also be people who use drugs. So I think it informs my work on a daily basis. Because stigma plays such a huge role in our society, when someone knows that someone else may have walked down a road they have, they will feel more open to sharing, because they'd may be hoping that this person won't judge me in the same way, because maybe they did, walk in my shoes to some degree, or understand where I'm at to some degree, because everyone's experience is individual. Most people start to use substances because it feels good. And I think it's really important that we don't lose that, to have effective strategies for, improving the health of folks that use substances. You have to look at it that way. You have to acknowledge the pleasure aspect. And especially when we talk about shame and stigma, because we make it this thing that you're supposed to be embarrassed of, or that isn't good for you. But people make all different kinds of choices. And I think the same happened all throughout, prevention around HIV. Like, you have to acknowledge, like, the ways in which people have sex and why, or else the messages you're giving to people are not going to be real to them, are not going to feel genuine, are not going to feel doable. I think the intersection of HIV and substance use has changed over the years. So when I first started doing harm reduction work in the 90s, I think it was still a lot about education and getting tools to people who needed them. And so you were still seeing folks getting HIV from sharing injection equipment. I don't think you see that as much anymore. There's such increased access, such increased education. What I do see happening is, various substances might affect how someone makes decisions in their life, whether that be around safer sex, or even just general self-care. If someone goes on a huge speed run, doesn't take their meds, or doesn't eat, doesn't drink, get dehydrated, really see their health deteriorate, the impact is there. I think what's most deadly for people that use drugs is shame, stigma, and isolation. And so, the opposite of that, the answer to that, is connection and compassion, and getting folks, more involved in their communities, not isolating them further, not ostracizing them, not making them feel like the other. Stigma really impacts someone's ability to feel self-worth and to make those healthy choices. And so when society is treating someone like they're nothing, or if someone's constantly getting that message, or that their life doesn't matter, that it's expendable, then they can start to they might internalize that and make just different choices, or choices that are just like, not even a choice. Like, screw it. None of this matters. I just want to feel good in this moment. Even when we talk about overdose, the people that are dying are people that are using alone, right? We could talk all day about naloxone as this, miraculous drugs that could reverse an opiate overdose. But the folks that are dying are living alone. They're getting high alone. There's no one there to use naloxone. And so I think connection is really key. And when folks feel connected and empowered, they can make different choices. I think in this moment in time, some of the greatest challenges are around barriers to care that exist. And COVID complicates this even further. Even for us at our harm reduction center, it was a place where folks could come and just hang out, have a meal, hang out, get tested, see the nurse. But because of COVID right now, you could really only just come by. It's like, to-go style. Get your supplies to go. You could still get an HIV test or a Hep C test, but that's a very different dynamic, right? You have to come there. Everything's done in this very sterile way. And so just being really, COVID's thrown a layer onto this whole situation that increases isolation even more. And we know that that isolation negatively impacts people's health when it comes to substance use, when it comes to HIV, when it comes to overdose.